So let's talk about attachment reminders. Here are the most, I would say, from seeing, hundreds of offices, what is most commonly missed when it comes to attachments or that causes claim denials or resubmissions that need to happen or just delayed payments is going to be these specific procedure codes. But of course, there's more beyond that. But these are the main ones that we see. So that's for crowns. A lot of the times we're missing the placement date. So that is something that now with the new claim form can be actually marked on the claim form, but it needs to also be in your clinical note documentation. So if this is a replacement, when was the prior placement date? And this does not have to be an exact date. If this was before the patient was a patient of your practice, you can ask the patient, is this older than 5 years, 10 years? Was it 2010, 2005? Try to get from the patient an estimate if it wasn't you that placed the prior crown. And then with implants, they are going to need to know all the missing tooth that's in the patient's mouth. And they usually are going to want to see an x-ray that shows the entire mouth at all as well. And this would be any type of implants or bridges. You want to make sure to be able to show that picture, whether FMS, pano, make sure you have those x-rays as well. And then the extraction dates. They're going to need to know when the teeth were extracted. And again, if this was 20 years ago, notate that. If you don't know the exact date, notate from the patient an estimated date. And then for your scaling and root plane, there's a lot of denials here. And I really believe that if we look through our documentation, we can help prevent a lot of these denials. So go through your clinical note templates for scaling and root planning. Is there anything that needs to be tweaked? Is it our process to get a full mouth set of x-rays? Panoramics are not the best x-rays for scaling and root planing. We need to be able to show that the evidence of bone loss. If there's not the radiographic evidence of bone loss, we need to make sure that's notated in the clinical notes because we don't want the insurance company to have to guess why this procedure was needed. And we need to be able to show that there is evidence of that bone loss. Build-ups, do we have our photos? Do we have our clinical notes? So if you're doing a build-up, making sure that you're specifying the reason the build-up was needed. Is it over 50% of the tooth structure had to be taken away to restore the crown? Make sure that it's documented in your clinical notes. Guards is a one that slips through the cracks all the time. My father did a lot of occlusal guards. I don't know if your practice does, but if they do, this will notoriously not always get flagged. So you need to make sure you have your clinical notes in there that it's for bruxism. Sometimes it's only covered after perio surgery. So again, let's go to our templates and see if we have all the checklist items we need to get the claim paid. And then root canals and extractions are another two that they can slip through. So you just want to double check it. Do we have our x-rays? Do we have our clinical notes? And again, I have more detailed information on what each procedure code should have attached to it with the downloadable freebie at the end.
Offices would say, where do I get started? And I think it's key because sitting down and actually working with practices all over the country of, well, the first thing that we need to have is we need to have a strategy roadmap, right? We need to have an action plan worksheet that we can all sit down in a morning huddle and say, what is one area, whether that's patient engagement. We talked about maybe reactivating patients who haven't been in yet this year and a campaign for outreach, those kinds of things. But what is one area we are going to work on and fix this week? It just has to be one, to your point. And then what type of patient outreach? Is it going to be for perio maintenance patients who need to get back in? Is it going to be for patients we haven't seen yet in 2025? Is it for unscheduled restorative patients? What patient outreach campaign are we going to do? Are we going to include a summer special for our patients, right? And what kind of contest do you think would motivate your team? And the best way to find this out is to ask the team. What would motivate you in a contest? Is it money? Is it recognition? Is it a spa day? Is it a massage? What is it that would really motivate you to step up and give extra and really contribute to the success of the practice? And if you're not tracking metrics, right? Because we can't manage what we don't measure. So if we're not managing our metrics on a daily or weekly, where we're keeping everyone informed and keeping people informed, which is also KPI, keeping people informed, which is what are we going to start tracking this week that we haven't tracked in the past, whether that is average patients per day, maybe it is my prophy to periodontal percentage. And that is done simply by generating a report of how many prophies versus how many periotherapies with those codes that I do since January 1st, and really sort of get a worksheet out. And we did provide this to Vyne clients who attended today on our website as well too, but creating that worksheet of where are we going to get started. And once you write it down, it becomes a plan, and then we create tasks around being able to do that, right? So I think that's really going to be key. And I think creating that one strategy that you may have heard today, what is one strategy that resonated with you? And that's the one you focus on. And to your point, Dr. Wingfield, is really involving the team in the process, letting me know how I contribute to the success of the practice. This isn't a doctor problem. This isn't an office manager problem or a hygiene problem. It's a team problem. And so we want to really address it and attack it that way. And remember that just making one small change can yield really big results for the rest of the summer and keep that momentum going, right?
So I did a workshop with a group. We had 250 people in the room. This was last Friday. The TDA was 2 Fridays ago. Make sure I'm staying on track with time here. 10, 12, we got 20 minutes. I gave them all Legos and I said, hey, build an animal. And then I said, take a picture of the animal. And then I said, okay, take the animal apart and I'm going to give you the instructions for the animal. And so you can see on the left-hand side, the first instructions was whatever that was, no instructions. But with the exact same pieces, when I gave the instructions, they created this chicken, this rooster, right? And the point here is that people alignment reduces leadership drag. If people know what to do, right, clearly, they have clear instructions and clear goals and all that, they can connect with the work and do it, make it easy. And that reduces leadership drag. That makes it easier for leaders to run a better business. It gives leaders more purpose because it's not always a bunch of challenges and firefighting and backstepping, and it's like, hey, we're going to attain goals and we're going to find meaning and purpose through our work. And it requires some things. It requires the leaders to give the employees, like, hey, this is what we're all about and this is what we're trying to accomplish, and then you empower those individuals to help contribute to that accomplishment. And your communications is key to helping the employees understand where they stand. Also, systems clarity prevents burnout. I talked about at the beginning that you want to make sure we endure through clarity and defining repeatable processes, creating reference tools, and delegate decisions. This clarity prevents burnout because life is easy while I'm at work. So when I go home, I can rest assured that everything is done. And I like that. So clarity removes friction and preserves everyone's endurance, not just leadership endurance. And this is why we built Dundesk, to help with that. I mean, not a plug for the software, but it's like there's a real purpose behind clearing up the processes and workflows to see everybody's getting things done.
And this is where we get into the point where we're going to handle the payment requests gracefully. If the patient asks about it, and well, wow, that's a lot of money. Do you have payment options? I can't pay that all up front. Don't jump straight into solutions by vomiting every payment solution that you have. It's important that you know what they are, and it's important that you're comfortable with what solutions you have in your office. So it's that's another step that the office has to take. You should have a menu of solutions that you can provide, because there's no one silver bullet that's going to help your patients get to yes. This is about being quiet, asking what their thoughts are, and then if they follow up with that question, well, do you have payment plans? You can say, yes, absolutely. We do have payment solutions that we're able to help pretty much most our patients get the treatment they need. What were your thoughts about a payment plan? Again, you don't know enough yet from the patient to know what they're thinking. They said they want some kind of payment plan, but for all you know, they may come back and say, hey, I just want to pay half now and half at the end. Don't assume that they need 6, 12 months. They might, but let them tell you first. Again, you're the guide. They'll give you the answers of what's going to be the best fit for them. And you want to avoid that listing of all these options up front, because again, you're going to overwhelm the patient, and that's when they're going to shut down on you. And kind of as a side note here, it's important not only to know all of the solutions, you need to know what type of things that you are allowed to offer inside as like in-office payment arrangements versus third-party payment arrangements and what you have. So this is that back and forth dialogue. So you can help sort of funnel the patient through questioning how to give them the best solution. So there are different ways when you have it. There's a ton of electronic solutions nowadays. If you really still like to have a financial form, we have ways of customizing a PDF that has all of your payment solutions that are already pre-calculated with the math in the background. So you just plug in the total treatment. You say if there's insurance that you're estimating you might have, and then boom, it'll go ahead and tell you what the monthly payments would be for maybe 4 different options that your office is willing to provide with certain thresholds of treatment. That's one solution, but we're going digital a lot.
We as offices have to pay a little bit closer attention. And again, I'll show you the steps to find what's in your area, but we have to be paying attention, because as much as we'd like to say, well, people should know their own dental. For the seniors, if you've ever tried to dig through what one of these plans offers, it's confusing as anything. And they get overwhelmed very easily, especially as they age. And so they have no idea. And this is where I feel it's on the office. It's good for us to learn it for them. United Healthcare emphasized access to dental, vision, and hearing. And in 2026, 94% of all Medicare eligible individuals have access to United Healthcare Medicare Advantage plan. United Healthcare is the largest across the country, offering in I don't remember exactly how many counties, but it's most of them. So the plans this year have a slight change. Nearly all offer benefits within preventive and comprehensive categories. Preventive benefits is back up to 98%, offering preventive, but comprehensive is down to 93. Last year, preventive was 98, comprehensive was 94, I think. So they're kind of flip-flopping a little bit on that. But interestingly enough, just note that comprehensive benefits, all they have to do to be able to put down that it's has comprehensive benefits is to cover one code in a section. So they could cover a crown recement, and that would be considered covering one code under restorative. They could cover for a single type of root canal. They simply have to cover one code in each of the sections of the code book to call it comprehensive. So read them carefully and make sure your seniors read them carefully, because the other thing we all know is a lot of times there's wait times throwing into these, or other little things that trip people up that are not real obvious when they look them over.
Which leads me to creating hard to find block types. So whatever is hard to find in your schedule during busy times, whether it's new patient appointments, whether it's production appointments, whether it's perio appointments, whatever it is, your hard to find times, block them now. And I'm a fan of, like having the perfect schedule, but a lot of times our team members schedule right over those perfect day scheduling. I say put a block in, put an event in, make it really hard for teams to just put another patient in so that we're holding those spots. Also look at online scheduling. If you're not already online scheduling, this is the time to get it set up. Patients are expecting this now. They want this opportunity to be able to click a link and get into your schedule. So if you haven't embraced it yet,
before the holiday rush. Reach out to the appropriate companies that can help you with this. And then also look at your automated recare reminders to try to get patients in sooner than later. Don't say end of the year is coming up, your insurance is running out. Say we are going to be full the end of this year, so use your insurance now. So really make sure that what you're saying in your reminders and your communication with your patients is saying get in now, which means we've got to work with our team. We've got to role play. We've got to make sure everyone's saying the same message.
So let's dive into number one. And this is a big one. And I think maybe the biggest of the five that we're going to talk about today, because the one thing that patients don't want to have are surprises. Any kind of surprise coming in. I think that we are in an age where dental patients understand their oral needs. Now, granted, I know you have some patients who walk into your practice and they are never going to show up unless they get a toothache or a broken crown or whatever it might be. There's no way they're going to walk through there for their 6-month hygiene appointment. They are merely coming in because they need something. However, I'm of the opinion that the more that we have the internet, the more that we start Googling our own symptoms and things like that, I think patients are starting to learn about the importance of oral health and the oral systemic link and all of those different things. So I think they want your services, but I also think that we have to make sure that whenever they get those services, that there's no surprises at the end. And I will tell you, there are some states out there that have what are called no surprise laws whenever it comes to any kind of medicine, including dentistry. So I want to make sure that your state, your state's laws whenever it comes to billing and making sure that there are no surprises there as well. So how do we do that? Absolutely. I think discussing estimated costs is a very important thing. Providing something written is extremely important, as well as think about how you're communicating with that patient. The last thing that you want is any kind of confusion at all whenever it comes to the final cost. And I will tell you, Dana and I were talking a little bit before I did this presentation, and one of the things that she tells me is that a lot of the practices that she works with, she actually takes she asks them to take the insurance estimate off the paperwork. That way they can focus more on the patient portion and actually what they're being asked to provide, not just the whole setup. But if you take a little bit of that insurance premium away and you just show them their payment, then that reduces the confusion a little bit. Because one thing that we know is a confused patient will almost certainly always say no. If there's any kind of confusion, there's going to be hesitancy. So we want to eliminate as much confusion as possible, as well as any kind of surprises or any kind of shock that there might be.
We're going to think about this a little bit further. This is great for marriages and children and our family relationships, how you show your love. But I want to also share with you that Dr. Gary Chapman, just maybe 8, 9, maybe 10 years ago now, came out with this book with Dr. Paul White, and it's the 5 love languages of appreciation in the workplace. That's why it's here important for us today. So get you a copy of this red book. It's very, very helpful. You can also download it and listen to it on Audible. So why does that matter to our patients? Why am I even bringing all this lovey stuff up? I know it's Valentine's Day, but why are we bringing it up? It's because you guys entered into dentistry because you wanted to serve patients and you wanted to take great care of your community. And here's what I know. Of these 5 love languages, every patient that walks through your practice, they are going to have one of these that fills up their gas tank. So let's dive a little deeper into these 5 love languages. I'm going to start first with acts of service. And remember, I told you that's something like filling up my gas tank. So let's think about for a patient. What is an act of service that we can do to show our patients that we really love them? So, one of the things could be a personalized welcome or some way of greeting them when they walk into the office. So, those of you that know me, anytime you run into me at a conference, I will always greet you with welcome to work because I want to show everybody that I love them with a powerful welcome to work. So that is an act of service that you can do to greet your patients when they're coming into your practice, to show them that you care about them. Think about using their name too. Sometimes we get really busy and we don't always know who's exactly coming in at 10 o'clock. And that could be a great way for us to show our patients how much we love them. Think about this, a pre-appointment check-in call. Work with me here for a second. You know, we do confirmation calls, and now we do confirmation texts and emails and smoke signals and everything, right? Well, what if we could have a pre-appointment check-in call? And it might sound something like this. Hey, Dana, this is Emmy over at Fantastic Dental. I'm just calling you for two reasons. The first one is I wanted to tell you that the team is super excited about seeing you on Wednesday. They've got everything that they need for a great appointment. And the second thing is I just wanted to know, are there any specific questions that you have for us before you come? That's different. That's more personal. I know we got to do text because we're busy people, but if we really want to try to reach out and show the love for our patients, that might be an easy way to do that. Think about your customized aftercare call. So, you know, major dentistry, so an implant or an all on four or just multi extractions or something like that. Doing that follow up personal care call with your patients is a great way to serve them. You can also, let's talk about financial arrangements and clear transparency. So, you know how a lot of times coaching with dental teams, this is what I see. I see maybe they'll have a little care credit sticker right there in their office, and they just assume, you know, well, you shouldn't assume, but they just assume that the patient knows about care credit. So why don't we instead take the time to really explain, this is your treatment plan. This is what we anticipate that your insurance company may or may not cover. May not cover. Uh, and this is the amount that we can expect for you to have to be responsible for that specific day. Tell me how I can help you make this fit within your budget.
Say no to narratives. I still even find myself using narratives interchangeably with clinical notes, and we just have to say no more to narratives. We used to, back in the day, you copied and pasted your stock narratives to send claims. A lot of times you didn't even add anything to the remarks section, and this was 10 years ago. Now, though, it is imperative that we are not using stock narratives or putting anything in the remarks section of the claim that is not in the clinical documentation in the patient's chart. This is for compliance and insurance regulations, so it's very, very important that anything that's going on your claim form is in the clinical notes. So if you don't know where to start with your clinical notes template, please email me. I have for all the procedures, what you need to document for the claim to get processed. Then you can take that information and make sure that that's covered in your clinical notes. Your templates in most practice management softwares, they have it set up so you don't have to think about it each and every time. It will prompt you to the things that you need to fill in the blanks for. So going forward, we're just going to say no to narratives.
This is probably one of my favorite things to talk about. I think I'd say that about almost every topic though. But for real, text to pay is a game changer. And honestly, whether you're using Vyne or another software, the principle stands. It is 2025 going into 2026. People don't want to call. Millennials, Gen Z, they would rather, I heard someone yesterday say they'd rather chew off their right arm than pick up the phone and make a phone call. Like, if you want to get paid faster, you have to make it easy for them. 70% of people prefer to pay online, and they want to click on the thing and their card fills in. They want to use Apple Pay. They want to use the tap to pay. They want to make paying easier, and we can do that for them so easily in 2025. What also is cool about text to pay is the automated reminders. So you can set up an auto cadence where, like, your team sends out the first request. Okay, we're going to send this person a statement, and then every 5-7 whatever, 14 days, whatever you want it to do, it will automatically send them a reminder so your team doesn't have to do that every single day for that same patient. And I know the next thing that happens is the teams that are like, well, we tried it, and then like they have these really significant stories in their mind that someone called and they were really unhappy because they got a text to pay or they thought it was a scam or something. But I just want to encourage you, if you have 2 or 3,000 patients and 3 of them call and complain, we don't need to make rules for that tiny percentage. I mean, even if it's 1% of your patient base, the good news is they can just opt out if they don't like it. But the vast majority, they don't complain, they just pay. You get paid faster. And like people are, there are a lot of times they're not available during business hours. We need to make it so easy for us to get our money on a timely manner without so much of an admin burden of having to call every time. So often teams are only sending reminders for whether it's paper statements or text statements, they're only sending them once a month. And people in 2025 are used to getting bombarded by notifications. That is just not enough anymore. I would say once a week is a great cadence. I've heard other companies say once every 3 days is a great cadence. Figure out what works for you, maybe dip your toe in the water, but I would highly encourage you to use that function of the auto reminders. And then in some softwares, it also writes the payment back into your software, which is really, really nice. So this automation frees up your team. It keeps your cash flowing, and honestly, it keeps your prices down, your overhead, because you're not like spending money on paper and stamps all the time. It's really wonderful.